I'm Dr. Mandy Wyatt with Family Chiropractic and Wellness, and I wanted to take a moment just to talk about a couple things that we commonly see with patients, both on x-ray but also with a good hands-on exam. So for a lot of people, they've never had x-rays or MRI or any sort of imaging done, and if they are having a lot of neck issues or upper back issues, I do like to usually get a look at that area. So from a straight-on view of the neck, upper back area, you would be looking at yourself here from front to back. We should see that everything is nice and straight up and down at the spine. It should be level across the shoulders. You should be nice and level across the base of the skull. So from a straight-on view, we can commonly tell if there is curvature. A common misconception is that all curvature is scoliosis. Scoliosis is a certain degree of curve. So you can have curvature without it being called scoliosis, and x-ray can really tell us that. That can explain some asymmetries that we might see across the shoulders, across the hips. That can also sometimes go along with some of the symptoms that we're having. From a side view is usually where I get most of my information. So from a side view, this is the back of the head right here. You should have curve in the spine. You should have a forward C curve in the neck, and then the opposite way through that upper back. So from a side view, we very often see that people have lost that curve in their neck. And that can be because of, it can be because of a whiplash or a trauma or an injury in the past. Even if a car accident was 20, 30 years ago, it can affect how this is going to look down the road. But it's also more commonly from posture. Day to day, a lot of people tend to sit with shoulders forward and head forward, especially computer workers. Tend to sit with kind of that slouched posture, so over time they lose that curvature in their neck. When you lose that curve in your neck, it really changes the mechanics of the area. And so that's going to turn into symptoms or some sort of findings down the road. So we can see on an x-ray, usually for people, if they have lost that curve in the neck, or if it's gotten so bad to the point where it's actually curving the opposite direction of normal. That's called a reversed lordosis. This can cause a number of symptoms: headaches, tension, soreness down into the neck, down into the shoulders, and down into the mid-back. And then it can also cause upper neck conditions like vertigo, insomnia type issues, ear issues. All sorts of things are really tied into the upper neck as well. So from a side view, we usually do see that we have this change in the curve, and also that can cause arthritis over time, degenerative arthritis, which is also called osteoarthritis. That's because when you have this nice healthy curve, most of the day-to-day force go through these joints in the back of the spine. When you lose that curve in your neck, it shifts that 8-pound head weight forward onto the discs. They start to wear out over time. So at first it's classified as degenerative disc disease. Over time it's classified as osteoarthritis. And a lot of people think they go get x-rays and their family doctor might say you have arthritis, but they don't really offer a solution or anything that they can do about it. There are things you can do to slow arthritis down, and that really comes down to correcting this curve in the neck, which can be done with chiropractic, ergonomics, home stretches, and also working on really preventing any further degeneration from happening in that area. So if any of that sounded like you, I'd be happy to sit down and see if I could be of help.